All right, next we'll move on to our Blue Cross programs that we have here. We'll start with our most popular. It's our fitness discount program. If you work out 8 times per month, you can get up to a $20 credit. We have over 800 gyms participating in Minnesota, many gyms that participate outside of the state of Minnesota. 2 adults in the home can participate in this program. So you can get up to a $40 credit back on your gym dues. Keep in mind the second adult, they do need to be on your health plan. So they do need to be on the Blue Cross insurance in order to be eligible for the fitness discount program. We also have our 24-hour nurse line. It's very similar to the triage nurse at your local clinic. We have registered nurses. It's telephone-based. They're able to give safe and professional decisions, and it's no cost to you. We then have our EAP program, our Employee Assistance Program. It's confidential. It's available 24/7. Some of the issues that they can assist with: marriage, mental health, legal, childcare, situations at work. And then followed by our Healthy Start Prenatal Program for moms-to-be. You work with our registered nurses at Blue Cross Blue Shield throughout your pregnancy, and it's just there to add that extra support mom might need besides their physician. Sometimes we find that we see our physician, we forget a question, and I know for me, I have to call and it might take a day for my physician to get back to me. You can always call or email the registered nurse at Blue Cross Blue Shield and they'll get back to you as soon as possible with your answer. And for completing the program, it's a $50 gift card that the mother receives to use. And then we also have our Enhanced Stop Smoking program, up to 5 calls with our Quick Coach counselor, and then also 2 up to 3 calls from a weight coach. And then all your quit meds are covered at no cost to the member. We have our over-the-counter drug benefit program. We have a list on our website. It covers some antihistamines and the proton pump inhibitors. So again, there's a list out on our website. If your drug falls on that list, you can get that drug at no cost. A couple things to keep in mind with this program. You do need to get an over-the-counter version prescription from your doctor. Take that to your pharmacy. They'll load it on file, and then going forward, you'll get that prescription at no cost. And that's some antihistamines and the proton pump inhibitors. We also have our retail health clinics. Retail health clinics, those are the CVS, the Target clinics, Minute clinics, etc. They're covered at 100% no matter what plan you take. So if you take the copay plan or you take the HRA plan under either network, they're covered at 100%. Retail health clinics treat more of the minor illnesses: pink eye, strep throat, ear infections, coughs, cold, etc. So if you're on an HRA plan, this is a great way to save money. Retail health clinics, they're 100%, there's no cost to you. So take advantage of these. Again, HRA plan, that's a way to save your dollars, to preserve your dollars. And then you'll also see the Anoka County Well at Work on-site clinic is also no copay and no co-insurance. Next, we'll move on to My Blue Cross. Now, to sign up for My Blue Cross, again, BlueCrossMN.com. Down at the left-hand side is what you'll want to select there, My Blue Cross Member Center. It then will bring you to this page to register. My Blue Cross, you'll need to wait till you get your ID card to sign up, because it'll just ask you your XC number, your name, so you'll need the XC number in order to sign up for this. And then once you've signed up for My Blue Cross, once you're out there, you can see all your claims, your pharmacy, your medical claims, your FSA, your HRA information will be out there. You can see where you're at with your deductible and out-of-pocket. You can order ID cards. All your explanation of benefits will be available out there. Lots of wellness information. So definitely sign up for this once you guys get your ID cards. Keep in mind, if you have a spouse or any dependents age 12 and over, they will need to register on their own. You will not have access to their claims information. Yeah, and that's her comment was 12, and I agree. But that is not a Blue Cross rule. That's part of protected health information. That's part of HIPAA privacy. And then also I put a slide in here, cdhp.bluecrossmn.com. This will also give you more information on your HRA and your FSAs. All right, what is Online Care Anywhere? It's an online health care system that allows Minnesota residents to visit physicians live via the web or telephone. Conversations are immediate, secure, and private, and online care happens in real time. So you guys are familiar with virtual, with online care anywhere. You are seeing an actual physician. So you're seeing an actual doctor. If you have webcam, you go on online care, you fill out a couple questions, you're immediately put in contact with an actual doctor. And this is, I jumped ahead here to show you what the screen will look like. So you'll see that doctor right away. If you don't have a webcam, you can always do email and phone. There's no appointments needed. The visits only take about 10 to 15 minutes, and this is being provided free to all Anoka County employees and also your dependents. So regardless if your dependents are on your health insurance plan, they can also use online care at no cost. And towards the end of the year, everyone will get a coupon code. So when you go on to online care anywhere, you'll just enter in that coupon code and you will not pay for the visit. Also show the hours of operations up here. Really nice on the weekends and holidays if something comes up. One thing to note is that you do have to be in the state of Minnesota physically using online care. And the reason for that is that we contract with Fairview doctors. They're only credentialed in the state of Minnesota. If we jump ahead here, some of the common uses of online care anywhere: sinus, sore throat, ear infection, cough, cold, medication refills, flu, allergies. So these doctors can write prescriptions. When you're answering the questions at the beginning, they will ask what pharmacy you'd like your prescription sent to. They'll send it directly to your pharmacy, then you can go and pick that up. Keep in mind, if you do get a prescription, that won't be free. That'll apply under your drug benefit depending on which plan you've chosen. But your actual visit will be free. Any questions on online care anywhere and how that works? All right, that's all I have. Thank you, guys.
Okay, just to go through a few things. All of you were able to pick up a resource guide in the back. We do also have that on our website. And then once the Blue Cross Blue Shield landing site is live in the next week or so, you can view it there. If you want to see a copy of this presentation, that is also on the employee website, so you can always go back out there and look at it. And then, as we mentioned at the beginning, this session has been recorded, and so we will also be putting that on our website and that Blue Cross Blue Shield landing site. So if you want to see this video, if there were some questions or concerns that you didn't quite catch or that you still have questions on, you can go back and watch that video or attend another session. But what's nice is you can also share that with your family members. So if you're trying to explain these benefits to your spouse or your children, or you have a student that is out of state and you want them to see how this plan is set up, in the next couple weeks, we'll have that link out there, and you can go out to, you can send that link for that Blue Cross Blue Shield site to them, and it'll have this presentation, the resource guide. It'll have directory search instructions. We mentioned that the AWARE network is very large. It's their largest network available. They've also got their national network. And if you're thinking about the regional network, that's actually pretty broad as well. We do have some search instructions that are in the video or in the presentation. We've got on the employee website a more detailed step-by-step. And up here we do have a list of kind of those key providers. For example, a lot of the providers in Tier 1 are ones you're probably familiar with: Alina, Aspen, Fairview, North Clinics, Health Partners, Park Nicollet, and so a lot of those are under that Tier 1, but you can look all of those up online. Now, as we mentioned, if you don't do anything at all, your coverage will remain as is. So if you don't have coverage in place, you're not automatically going to get enrolled 1-1. If you've got single coverage of the 100% $20 copay program and do nothing, you're going to roll to that AWARE single 100% $20 copay program. Or if you've got family coverage, everyone will switch over. If you're on that high deductible, you and every family member will go to that AWARE high deductible. So if you have family members to add or delete, or you want to change plans, such as maybe looking at that regional high deductible program or going back and forth between any one of the other programs, we do have a form that's required to be filled out, and that would need to be returned to Human Resources by Wednesday, November 21st, which is the day before Thanksgiving. And again, those forms are all out on our employee website as well. So thank you very much. If anyone has any additional questions, we'll stick around, but we appreciate you coming today.